Welcome to the Loving Support WIC Peer Counseling Training Program for WIC managers, coordinators, and supervisors. This training has been developed through a cooperative agreement between the USDA Food and Nutrition Service and Every Mother, Inc. It is designed to help state and local WIC agencies implement and sustain successful peer counseling programs that help participants in the Special Supplemental Nutrition Program for women, infants, and children receive the help they need to reach their breastfeeding goals. The training program for WIC Peer Counseling Program managers, coordinators, and supervisors provides program guidance based on the FNS Loving Support model, research on the evidence behind peer counseling, best practices adopted by state and local WIC agencies across the country, and solutions to address common challenges. State and local agency showcases are also included to highlight successful strategies. The curriculum is divided into 10 major sections. Each section is important for training new managers and for staff in existing programs to assure continued best practices in program management. Each section has an accompanying notebook and handouts. Feedback from participants during in-person training indicated the notebook was an extremely valuable resource. Both the notebook and handouts are accessible on the Maryland WIC SharePoint website. Please print each notebook section and the handouts prior to viewing the webinars so that you can follow along, take notes, and reference handouts as they are discussed. Welcome to Section 7, Practice Settings for Peer Counselors. This section will address common practice settings for peer counselors and policies to consider in moving them beyond the WIC clinic into the community. At the conclusion of this webinar, WIC managers will be able to identify at least 2 strategies for using peer counselors effectively in settings beyond the WIC clinic. Peer counselors work in a variety of locations to serve the needs of the WIC community. This includes work within and beyond the WIC clinic and usual WIC clinic hours. It involves work in hospitals and private clinics, in community sites for classes and support group meetings, and by telephone from the peer counselor's home. Social media and text messaging are preferred methods of communication among young mothers and peer counselors. It has become a quick and easy way to connect. Each agency should determine the unique needs of their WIC participants to identify the settings and strategies that will best reach them. Policies can then be structured to address the identified strategies so that expectations are clear for everyone involved. This section provides options to consider and best practices being used by state and local agencies. Research with WIC agencies, peer counselors, and participants reveals that the key to success with peer counseling is being available to mothers when they need it most. Breastfeeding problems often occur outside usual business hours, and peer counselors provide important support beyond usual WIC services. Peer counselors help fill the gap in breastfeeding services. This is true particularly in areas where there are limited WIC health professional support resources outside regular working hours. Being available to WIC mothers beyond the WIC clinic hours and environment is a key component of the Loving Support model for peer counseling programs. Each agency should determine strategies that best enables them to facilitate that access. Telephone contacts are considered the centerpiece of many peer counseling programs in WIC. Telephone contacts enable peer counselors to be available to clients at times of crisis, when mothers are most vulnerable and likely to discontinue breastfeeding. Research shows that a WIC mother is most likely to begin supplementing or wean in the first few days after the baby is born. One study found that 92% of new mothers experience breastfeeding challenges during the first 3 days postpartum. If a mother doubts her milk production and her family is pressuring her to begin using formula, breastfeeding can come to a quick end in the absence of correct information and support. Often these worries can rise during evenings and weekends when families are visiting and mothers are fatigued. Being available outside of regular clinic hours gives mothers a lifeline to support and help when other health services may not be accessible. Being available to WIC participants beyond clinic hours can be workable with thoughtful planning. Some mothers will phone at inconvenient times if they are worried and feeling overwhelmed. However, most mothers do not phone even when they are experiencing problems. Many WIC staff believe when mothers feel vulnerable, they consider calling for help as an admission of failure. Family members are nearby and are trusted sources of information. It is extremely important for peer counselors to initiate contacts with new mothers, especially in the early days when many things can change within hours. The most likely time when a mother might call at an inconvenient time tends to be in the early days postpartum, a limited window of time. Mothers who are sleep deprived with wildly fluctuating hormones often are unaware of days and nights and other happenings. When things settle down, they are less likely to call at inopportune times. WIC agencies have recommended several best practices to consider in helping peer counselors manage availability in a way that does not compromise their personal needs. Setting boundaries helps peer counselors make their job more manageable outside the WIC clinic. Let moms know the best times to call. It is okay for the peer counselor to remind them that they are mothers with children too. Let the moms know which hours are best for taking calls. Some peer counselors tell mothers they prefer not to receive calls at dinner time or after 8 p.m. Or they might let moms know they will return calls or texts within a certain period of time. If a call comes at an inopportune time, it is okay for the peer counselor to let the mother know her call is important to her, but that her family needs her right now, and she will return the call later. She can return the call promptly when it is convenient. Peer counselors should never give out personal information such as their home address. Some programs do not allow peer counselors to give their telephone number and protect their privacy by providing a cell phone. Turn off the phone during inconvenient times. When the phone is on again, check for messages and return calls as soon as possible. Missed calls identified on the caller ID are an indication that help is needed. Some agencies that provide cell phones ask that peer counselors share the phones with others when unavailable. That way someone else can accept calls when mothers have concerns. Many WIC agencies that once provided pagers now provide cell phones with voicemail and texting options. More cost-effective overall as it increases accessibility to mothers, enhance safety for the peer counselor, eliminates long-distance charges, and eliminates the need for itemized reporting of personal cell phone use charges for business. Peer counselors are also able to connect with new moms via texting. Because confidentiality is a concern of many agencies, peer counselors must be taught the appropriate use of the cell phone. It should not be easily accessed by other family members, and it must be turned off when peer counselors are not accepting calls. It should be kept with the peer counselor or locked up when not in use. Many cell phones have a feature requiring a passcode to be able to use it. Peer counselors are encouraged to put a signature on their phone so moms will know who is calling. It may cost a mother to call the voicemail. Peer counselors often report frustrations making phone calls to WIC participants. Phones are often disconnected, or mothers give the wrong number, do not return calls, or simply do not answer the phone. The reasons are varied, including lack of time by WIC participants, lack of financial resources to pay for the phone or talk minutes, or reluctance to answer the phone from someone they do not know. Most peer counselors report that this is not the preferred method of communication for young mothers today. Many peer counselors report that mothers do not reach out to them even when they have established a relationship. Mothers often say they are concerned they will bother the peer counselor. Abundant research today shows that women of childbearing age overwhelmingly prefer to communicate by text or through social media. Text messaging was shown in one study to increase exclusive breastfeeding rates. The study provided focus groups with automated text messages on solutions for common early challenges, affirming statements, contact information, and links for further help and support. Some of our local agencies are adopting similar methods of communication. Feedback from both state and local WIC agencies confirms that many WIC mothers prefer to communicate by text. They are more likely to respond to texts and like knowing who is contacting them before taking a call. For many WIC participants, texting plans are unlimited while talk minutes are limited and expensive. Texting can be more economical for our participants. Although not all local agencies allow texting, growing numbers of WIC agencies do permit peer counselors to use this important means of communication. Some agencies provide unlimited texting plans for their peer counselors, citing nominal costs. One state found that annual costs for unlimited texting for 8 to 10 peer counselors was approximately $1,500. Some agencies that allow texting ask peer counselors to limit it to quick messages such as checking in, appointment reminders, class invitations, etc. Others allow it to be used for basic breastfeeding education. Many peer counselors use text messaging for this quick check-in and then follow up by phone if the mother is willing and able. Texting can also be used to send links to reputable online resources for information and support. Some agencies ask peer counselors to report text messages the same way they document bulk or volume calls. Another option is to document the text message with the follow-up phone call. Social media is a dominant form of communication, especially for pregnant and new mothers. 3 out of every 4 millennials use social networking sites. Time spent on social media sites increases dramatically among new young mothers. Social media creates a strong and powerful sense of community among users. Please refer to Policy and Procedure 1.10 for details on Maryland WIC's social media policies. Some of our local agencies use social media sites such as Facebook to alert participants to classes and other local agency events. Social media is not to be used as a forum for breastfeeding support by peer counselors or other WIC staff. Some of our WIC agencies have peer counselors visit new moms in the hospital to provide direct one-on-one assistance in the critical first few days postpartum. Some visit the hospital as friends or visitors to greet new mothers and make a WIC referral. In some communities, the hospital faxes a list of WIC mothers who have delivered to the WIC office following confidentiality agreements established between the hospital and WIC. Peer counselors then check the list and conduct follow-up. Setting up a relationship with the hospital to facilitate seamless follow-up of new mothers after discharge helps get mothers quick support in the critical early days of breastfeeding. Benefits of hospital collaboration for WIC mothers include reinforcement of education given prenatally, allows a mother to meet her peer counselor if she has not done so already to build a relationship, establishes intimate relationships at a sensitive and important time, helps mothers gain confidence with breastfeeding in the critical first days, and to know who they contact with questions later. Education can include the entire family to encourage ongoing support. Benefits of collaboration to the hospital include improved quality of care, freeing up busy nursing staff for other duties, improved patient satisfaction with their hospital experience, and better recognition in the community. If you would like to promote peer counseling to the hospital, Begin by contacting the hospital lactation consultant. Outreach to IBCLC groups or breastfeeding coalitions may offer opportunities for collaboration. Set a formal meeting between the WIC director and peer counseling coordinator with the hospital director of nursing, lactation consultant, and other key staff where you can share WIC's goals and services, mission, and desire to raise exclusive breastfeeding rates. The role of peer counselors as an adjunct to care and an accessory to the usual hospital breastfeeding services. Examples of hospitals successfully using peer counselors, the curriculum used to train peer counselors, the scope of practice for peer counselors, and breastfeeding rates of WIC mothers in their community. Follow the hospital's lead and offer to provide more information if needed. A formal agreement can be used to clarify roles of the peer counselors, communication, and referrals. While in the hospital, the peer counselor respects the entire team caring for the mother. Her role should be clearly identified with the hospital team so that she does not overstep her bounds. In many hospitals, peer counselors do not offer hands-on assistance. They meet the mother, provide encouragement, and arrange for a follow-up telephone call after the mother leaves the hospital. A new mother who feels stressed or overwhelmed to meet a supportive friend may be more comfortable calling her later with questions and concerns. In some cases, peer counselors help mothers position and latch the baby. Peer counselors working in the hospital report any concerns the mother may have to the lactation team leader or designated contact in the hospital. The WIC clinic provides an important venue for face-to-face contacts with WIC mothers. Peer counselors believe that in-person consults help mothers feel more comfortable with them. This makes follow-up text and telephone contacts more meaningful and productive. Peer counselors are used in a variety of ways in the WIC clinic setting. They see mothers routinely as part of the normal clinic flow, or they may conduct group education or facilitate mothers groups. They also make appointments with mothers who need assistance with breastfeeding and are able to spend more time with the new mother than the certifier can during a routine WIC appointment. Local WIC agencies will need to determine the appropriate balance for peer counselor contacts both within and beyond the WIC clinic environment. In-clinic contacts can be a valuable way for peer counselors to build relationships with WIC participants and to integrate services as part of the WIC clinic flow. Peer counselors can use downtime to initiate calls, texts with pregnant or breastfeeding mothers. When limited hours are available, it might not always be efficient for peer counselors to spend large amounts of time in the clinic. Some agencies ask peer counselors to be in the clinic on busy certification days to conduct in-person visits. Often, classes and support group meetings are scheduled on peak days, which helps peer counselors consolidate their time in the clinic. Agencies should allocate time beyond the WIC clinic hours for peer counselors to be available to moms who have questions and concerns. Each agency will determine what will best meet the needs of the greatest number of WIC participants. Some peer counselors work during peak hours rather than a full day. If multiple peer counselors are available, set schedules to provide for as much staff coverage as possible to accommodate both scheduled and walk-in participants who need breastfeeding help. Multiple peers working in the clinic at the same time can divide responsibilities, such as checking new deliveries and conducting follow-up, handling consultations of mothers in the clinic, following up on referrals, making hospital visits, making calls to mothers due to deliver soon, sending class invitations, or preparing for group education. Some clinics designate a senior peer counselor to coordinate activities. If limited peer counselor hours results in reduced coverage, prioritize clinic time based on peak caseload days. Instruct certifiers to make immediate referrals to peer counselors so they can follow up by phone. Identify workspaces in the clinic for peer counselors to see mothers one-on-one when needed. Respect mothers' privacy, as they might not be comfortable talking about breastfeeding with a peer counselor in a public venue. If space is limited, consider inviting peer counselors to conduct counseling sessions in the clinic lactation room or conference room. Provide a colorful screen to enclose a corner of a room and provide privacy. Provide peer counselors with a laptop computer to enable them to document from off-site locations and upload to the main system. Allow peer counselors to work from home during non-office hours. Work with clinic staff to consolidate WIC appointments on the same day so peer counselors can periodically meet mothers in unused space. Invite peer counselors to conduct group education in the waiting room on busy days. Connecting mothers to one another through group meetings at the WIC office or in the community is an important aspect of mother-to-mother support. Support groups enable WIC staff to answer questions for new moms. The group also gains confidence as they see other mothers working through challenges. WIC agencies often find that for these groups to be successful, they need to be called something other than support groups. Many mothers may not feel they need support. Other names used include Mothers Group, Mommy and Me, New Mom Group, and Just Between Us Moms. Peer counselors often lead the support group meetings and present a variety of topics. Group meetings cannot be counted as second nutrition education contacts unless a CPA is providing education. Careful planning can help address challenges such as getting mothers to come to meetings and sustaining meetings with limited staff. Peer counselors often assist with prenatal and postpartum group education events to help mothers prepare for breastfeeding and handle early challenges. Most agencies find that informal structures that facilitate discussion are more effective with WIC mothers than classes with formal agendas. This concludes Section 7, Practice Settings for Peer Counselors. Please continue on to Section 8, Training Peer Counselors.